Painful periods is one of the most common period complaints, but I sometimes feel that it doesn't get the recognition that it deserves because periods are normal, right? So you might feel a bit strange telling someone, "Oh, I can't come to work. I can't go to school. I can't come out because I've got painful periods." You feel judged like they're like, "You, snowflake. It's a period. You're going to be this precious. You're going to be like this every month." And you're like, "Yes, I am, because it bloody hurts." I really just want to take the time to explain what painful periods are, the two different types of painful periods and the differences between them, and also what causes painful periods, what can you do to help yourself at home, how to treat it, and also when to see your doctor. Because it's not normal for your periods to be so painful that it's interfering with your activities of daily living. Now, we're going to be talking about painful periods, which is known medically as dysmenorrhea. There are two types of painful periods or dysmenorrhea. There's primary dysmenorrhea and then there's secondary dysmenorrhea. Primary dysmenorrhea just describes painful periods in a woman where there is nothing wrong with the pelvic organs, so everything's working fine. This pain is generally related to the period. So it will come on just before the period, and it feels like just dull, crampy ache in the bottom of the stomach. It can radiate to the lower back. Some women even feel the pain in their thigh. Actually, talking of back pain when you've got period pain, this is called referred pain. So referred pain is when you are feeling pain in a part of the body that's actually different to the source of the pain. For example, when you're having a period and you've got pain coming from the uterus, you actually feel the pain in your back because you feel the pain in another part of the body that shares the same nerve supply. It's the same reason why heart attack pain is felt as pain in the left arm. You generally just feel unwell. There can be nausea, vomiting, diarrhea, dizziness, headache. Some women even faint because the pain is that bad. And usually, the pain could last for about 3 days and it gets better as the period progresses. You're probably thinking, well, if there's no problem with the pelvic organs, then why am I feeling such pain? In primary dysmenorrhea, the cause of the pain is due to a chemical called prostaglandin. Prostaglandin is released from the uterus during menstruation, so it stimulates the uterus to contract. Now, when the uterus is contracting, the blood vessels inside are being squashed. Because blood carries oxygen, that means that during contractions, there's less oxygen being delivered to the muscle of the uterus. This causes the pain. This gives you that crampy pain that you're getting. This is important for later on when I talk about what medication best treats period pain. Remember that about prostaglandins. There are other factors as well that make periods painful for some women and not for others. For example, we all have different thresholds. I personally know that I cry when I have a wax. I find that really painful. Also, for women that suffer from heavy periods and pass clots, especially big clots, that can be painful to pass because the uterus has to contract in order to be able to expel this clot out of the cervix, which is like a tiny hole. And that gives this crampy pain. And once the clot is passed, which you can sometimes feel, you feel, oh, the pain is so much better. Although in primary dysmenorrhea, there isn't any abnormality of the pelvic organs, there are some risk factors which make you more likely to suffer from primary dysmenorrhea. These are starting your periods before the age of 12, being obese, being a smoker, having somebody in your family who suffers from painful periods, if you suffer from heavy or prolonged periods, or if you've never had children, because we know that painful periods are not as common in women that have had children, and also they tend to improve after childbirth. Okay, so now let's talk about secondary dysmenorrhea. In this type of painful periods, the cause is due to some abnormality in the pelvis. So something is going on with either the ovaries or the fallopian tubes or the uterus. The pattern of the pain in secondary dysmenorrhea is different from that in primary dysmenorrhea. What you might notice is that initially you had pain-free periods. You were fine. Then somewhere around your 20s or your 30s, you start to notice that your periods are becoming painful. Then you might start noticing that actually the pain is not related to your periods at all. It can be there before your periods start. It gets worse definitely when your periods are there. But then even after your periods have gone, you've still got pain. You might notice other symptoms as well. For example, bloating of your tummy or some heaviness in the pelvis, like a heavy feeling. And then you might also notice some other gynecological symptoms as well. For example, bleeding in between your periods, heavy periods, or bleeding after sex. I do have a separate video called 7 period signs not to ignore, which you can check here if you want to know more information. Also, if you have some of these symptoms, you might find it useful to watch my other video called Painful Sex. There are many causes of secondary dysmenorrhea. Some are more common than others, and it's outside of the scope of this video for me to go through every single cause. I thought I'd just touch on just a few of the more common ones. For example, endometriosis. This is a really common condition where the lining of the uterus basically is misbehaving and it goes and implants itself outside the uterus. But even though it's outside the uterus, it still builds up every month and bleeds every month, but there's no way for that blood to go, so it's bleeding into the pelvis. This can be painful. There is another related condition to endometriosis called adenomyosis. Adenomyosis is not as common as endometriosis, but again, that lining of the uterus has gone and implanted itself somewhere where it shouldn't be. In adenomyosis, it's implanted itself in the actual muscle wall of the uterus. And you can imagine that every month this lining is bleeding into the muscle wall of the uterus, which is painful. Helminth inflammatory disease is another one. This is an infection of the female pelvic organs, the uterus, the fallopian tubes, the ovaries. And the majority of cases are caused by untreated sexually transmitted infections. They have basically had a chance to spread from the vagina up and into the pelvic organs. There are other causes as well, such as ovarian cyst and uterine polyp. So when a woman comes to me complaining of painful periods, there are certain characteristics that make me think, is this more likely to be secondary dysmenorrhea than primary? For example, if you are experiencing painful periods after the age of 25, then I'm thinking, could something be going on with the pelvic organs? Has something developed? Also, if you've got painful periods and infertility, for example, I might be thinking, okay, is there pelvic inflammatory disease? Is this due to fibroids? Is there some blockage of the fallopian tubes? If you have painful periods and heavy periods, and I might be thinking, is this fibroids? Is this adenomyosis? If you are having little or no response to the painkillers that we would normally use, then again I'd be thinking, what's going on here? Is there another cause that I need to look out for or that I need to detect or pick up on? Also, if you have a family history of some of these conditions, so somebody in your family suffers from fibroids, endometriosis, then again I'd be thinking, do you have secondary dysmenorrhea? So how do we diagnose dysmenorrhea? Well, for primary dysmenorrhea, the key is in the history, so that typical pain that's always been there since the start of your period, associated with the symptoms that I described before, and a normal pelvic examination, a normal ultrasound, if you have one, because we don't always have to request an ultrasound to diagnose this, and a normal STI screen. In a young woman, I'd be thinking, this is much more likely to be primary dysmenorrhea. To diagnose secondary dysmenorrhea, though, because there is actually some pathology that's in the pelvis, you really need, as well as a good history, some imaging to have a look at those pelvic organs. So this could be, for example, an ultrasound or an MRI or some more specialist tests, for example, where a camera is passed through the belly button to have a look into the pelvis to actually visualize and see the organs directly, and other types of tests where we use to highlight the tubes, the fallopian tubes to see if there's a blockage in them, or hysteroscopy, where a camera is passed into the uterus to actually look at the lining of the uterus and to see if there's a problem. Let's talk about treatments now. What can you do yourself at home and when is it time to go and see a doctor? As always, the treatment depends on the cause. With primary dysmenorrhea, there is no medical problem inside the pelvis, so we can just treat the pain. Whereas with secondary dysmenorrhea, you really need to treat the medical cause or the problem that's causing the pain and also treat the pain. Let's talk about these in two separate categories. Let's talk about self-help, the simple measures that you can take at home yourself. Then I'll also talk about the medical treatments. Some simple measures, such as positioning yourself in a particular way. Some women find that lying on their front or curling up into a ball actually just gives some relief from the pain. Others may find that using a heat pack or a hot water bottle on the tummy helps. With that, you need to be careful to make sure that first of all, the hot water bottle is not too hot because you can cause burns, but also it can cause a discoloration of the skin, which is called erythema bignum. It looks like a lacy, wavy rash on the skin, and it can actually be permanent. It's really important that you're not applying the hot water bottle directly onto the skin. Try and have some layer between the hot water bottle and your skin. So for example, like a t-shirt or some towel. The other thing that can really help is exercise. I know what you're thinking, you're like, is she kidding? I'm telling her that I've got period pains, and she's telling me to jump up and down. I know it sounds cliché because I feel like some of my friends are like, doctors just say this all the time, exercise. It helps with everything. How can exercise help period pain? I'm not talking about taking a kickboxing class or something like that. I'm just talking about gentle exercises. For some women, that could be stretching, it could be yoga. Even if you are feeling that bad that you really don't want to leave your house, you just want to be indoors, you can take your hot water bottle, you can lie on the floor and just do some floor exercises. It could be even just curling up in a ball and then stretching out or lifting your legs, finding some comfortable position you can try, which will help to relieve the pain. Something else that I wanted to mention is a TENS machine. It's a method of pain relief that uses tiny electrical currents to help relieve pain. There is evidence that this works, but there's not enough good quality evidence to say if it's a reliable form of pain relief. But saying that, some women use this machine for labor pain. Because it's actually got a very good safety profile, I think it's worth a trial. So if you have ever used one of these machines or if you plan on trying it, can you please comment below and let us know what your experiences have been? Share the knowledge so that other women can benefit as well. Okay, so let me tell you about medical treatments. There is a class of medication called nonsteroidal anti-inflammatory drugs, and we call them NSAIDs for short. They are effective in about 60% to 90% of patients with painful periods, so we use them first line. The way that they work is that they reduce T-inflammatory. As with all medication, you've got to be careful because there are some categories of patients that can't take NSAIDs. For example, if you suffer from kidney disease, if you've ever had a stomach ulcer, if you suffer from gastritis, if you've got severe asthma, if you have a bleeding disorder, or if you have an allergy to aspirin, please check with your doctor first to make sure that it's safe for you to take this medication. Examples of NSAIDs are ibuprofen, which is one that you can buy over the counter without a prescription from your doctor. Then you've got the prescription strength ones. The studies have shown that there isn't one type of NSAID that's superior to the other. So you can actually try different ones and pick the one that you find works best for you. The one thing that I would say, though, is that aspirin tends not to work as well as these other NSAIDs. I wouldn't necessarily recommend aspirin. You can also add in paracetamol. I know that by itself, paracetamol can have quite a weak effect for period pain, but if you combine it with an NSAID, then you can get better control of the pain. So with the NSAID, it's not just about which one you take, it's actually how you take it. So what I would recommend is that when you wake up in the morning on the day that you're expecting your period, if you can pinpoint it to the day, or if you can't, which most of us can't, as soon as you start getting those first rumblings of pain, you take your NSAID. And then after that, you take it regularly throughout the day. So if it's meant to be taken 3 times a day, you take it 3 times a day, even if your pain is well controlled. Because in that way, you are allowing the level of the medication to build up in your blood and to be able to control the pain, so that your pain doesn't get the opportunity to peak. But if you wait until the pain is established and then you take the NSAID, it can sometimes be less effective. It's almost like you're playing catch-up. It can be difficult to get on top of the pain even when you're taking regular doses. Do this for about 3 days because after 3 days, the pain tends to improve. And if you're finding that you are getting a little bit of breakthrough pain, so for example, you took your ibuprofen at 12 o'clock, and now it's not due again till 5 o'clock, and you've got pain or the pain is getting worse, this would be the opportunity to now add in paracetamol. For some of you, taking NSAIDs with paracetamol, taking it how I've just explained by keeping on top of the pain just is not enough. At this stage, it would start to recommend hormonal contraception. This is also his chemical, prostaglandin, which causes the painful contraction of the uterus, and they're also an AA good option for women who want contraception anyway and are also suffering from painful periods. The idea with this is that the hormonal contraception suppresses ovulation, reduces the production of the prostaglandins, and therefore reduces your pain. The other option is to use something called an IUS or an intrauterine system. This is a plastic device and it's inserted into the uterus. This helps to prevent the line of the uterus building up. For about 50% of women, they actually notice that after 12 months, their periods completely stop. For some women, this is amazing because they really don't want the periods anyway and it helps to reduce the pain. Don't confuse this with the copper coil, which looks similar because copper coils do the opposite and they can make your periods heavier and also more painful. For treating secondary dysmenorrhea, you can use all of the same treatments that I've just explained. But in addition, we also need to treat the cause and not just the pain. When should you be thinking about seeing a doctor if you've got painful periods? My videos are for educational purposes. I want to give you information that means that you can make really good decisions about your own health, but they can't replace an appointment with your own doctor who knows your medical history, who can take into consideration all of your risk factors and then give you a treatment plan that's tailored for you. If your periods are causing you so much pain that it's interfering with your life, it's interfering with work, it's interfering with school, then that's really the time to go and see a doctor and get yourself checked out. If you've tried these measures that I've explained and you're still suffering from painful periods, then that's another good time to go and see your doctor. With hormonal contraception, you would really need to get that from a doctor because there are some women who can't have certain types of hormonal contraception because of risk factors. So that would definitely need an appointment with your doctor or with a nurse to determine whether it's going to be safe for you to use. Also, if you have some of these symptoms that are associated with the pelvic conditions that I mentioned, for example, symptoms of endometriosis or pelvic pain, bleeding in between your periods, bleeding after sex, please also see your doctor. Thank you for watching this video. If you know someone who suffers some painful periods or who would benefit from this video, please share it. And if you've got any questions, please leave them in the comment section below, and I will try to answer as many of them as I can. Thank you.